I'm Dr. Ali. I'm a hematologist-oncologist with Maryland Oncology Hematology. I was born in the Midwest. I grew up in the South in New Orleans. After middle school, I came up to Maryland. I've been in Maryland most of my life. I did train in New York. I was there for about 10 years. But I'm back to my hometown, which I consider Maryland. As a kid, I loved science. Science was my best subject, most interesting. Everything was logical. That's what I really liked. And as I grew up, I realized that the human body is a big piece of science. And it's a very complex piece of science. So that plus the fact that I really like helping people. So nothing was better than keeping the interest in science, but also wanting to help people, and medicine naturally came along. I was into DNA sequencing. I actually worked as a molecular biologist before I went to medical school. So there was nothing better than oncology, because oncology now is very molecularly focused. Everything we do in oncology is personalized to a person's DNA, down to their genetics. So that's what drove me to oncology. Not only that, as a resident, I realized the way oncology patients are with their physicians, with their doctors, is very different than how other patients are with other specialties. For example, I started to notice that oncology patients treat their oncologists as family. They trust them. They won't do anything else what anybody says until the oncologist says this is okay. That's the type of relationship I wanted with my patients. A patient gets a diagnosis, and they're extremely freaked out. They're really worried. They start Googling things, they start going over everything. And the hardest thing for them is to understand that why do they have this diagnosis. My goal really is to look at each patient individually, whether it's their ethnicity, whether it's their gender, their molecular makeup, the actual cancer, sequence the cancer, determine what allows the cancer to grow, and really target their particular treatment to that particular patient. So really personalized approach to cancer treatment. And it is emotionally very challenging to hear that diagnosis, but I do tell them that we have a support system. We have social workers, we have nutritionists that will help you. We have financial counselors. We have many people that are going to help support you through this journey. So there's an app that I use with my patients, all my patients, to have the ability to text me directly, not only with the patient, but the patient's family as well, because you're not just treating the patient a lot of times, you're treating the whole family. The whole family gets affected by a patient's diagnosis. We don't just give you treatment, we determine what treatment is best for you. We do all the testing that needs to be done to find that personalized, targeted, best treatment for that particular cancer. When you come to a community practice like ours, you're not going to be treated like you're going to the MVA. You're actually going to be treated as if you're part of our family. We want to make you part of our family. We want to take care of you like you're part of our family.